Thank you, everyone, for hearing me today. I'm going to be talking about the using of virtual town halls for the promotion first of vaccine research when the vaccines were not developed for the COVID-19, and then how we target some vaccine hesitancy among minorities. Next slide. Next, please. I have no financial conflict of interest, and all the opinions I'm going to be saying are my own only. So for those who you don't know it, let me introduce you. This is SARS-CoV-2, which the disease called COVID-19, and it has killed already 4.7 million people worldwide, and it have killed 726,000 Americans up to date, and the numbers continue to climb by the day. So if you see this presentation a couple of months from now, those numbers are going to be probably changed. Next slide. And the biggest issue is the African American, the Latin community, were disproportionately impacted by the COVID due to socioeconomic factors. Next slide. But the issue is now we have a vaccine, but the vaccine hesitancy, it's a big problem. So that's the number from the household pulse survey, which is like a survey that the CDC monitors like vaccine hesitancy. It's like a 20-minute survey for people. This is like about 100,000 people that are like surveyed every week. And if you see, it's like there are people who say we will not get the vaccine by any means. And this is the latest data. And you can see that it varies by the state. And it continues to be a big issue. Next slide, please. Now, next. It's like when you see the risk for COVID-19 infection, hospitalization, and death, it varies a lot based on who you are. And we have been knowing that since the beginning of the pandemic. So for African American and Hispanics, it's the rates for hospitalization are like 3 times as much. The chances of getting sick for a Hispanic person, it's like twice as much almost. And the death goes from 2 to 2.3 times, which is like a much higher number. Why is that? Well, socioeconomic factors is the major role. Think about like how many of them will they work from home? How many do they have like a frontline jobs, access to healthcare, and social distancing? But interesting is when you account into like professions that are high earning, for example, African-American doctors and African-American lawyers, they still have higher numbers. And we're thinking the genetics also contributes to why it is happening, but major impact is basically socioeconomics. Now, what is the big issue? Next slide. So this is like great work from the Kaiser Family Foundation that in January of 2021, the communities that they were doing surveys of how likely are the people to get the vaccine. And as you can see, changes a lot basically also on if we are Hispanics, if we ask African Americans, if we ask the white population. So the conclusion that we have, please, is that the communities who need the vaccine the most were the ones getting it the least. So that's basically one of the major goals of my project. And even though I'm going to jump ahead and tell you a little bit about the end, next, I want to give you a little bit of hope. It's like the numbers are improving actually for minorities and the COVID-19 vaccine, and that it's a great news. There's still a lot of things to work, but we're seeing a trend towards basically like an increase in the people that are vaccinated. But when we started this project, the gap was more than 15 and even 20 points for some populations. Next, please. And one of the things is why there's so much distrust. There are reasons for distrust in the healthcare system that happen for many, many reasons. I'm not going to give you like all the reasons, but I always want to touch a little bit about this. So next, please. So is the Tuskegee study basically for African-American males that where they studied the natural progression of the disease and they didn't treat it for syphilis. The case of Henrietta Lodge, an African-American patient that they took their cells for research without her consent. The famous article in the Lancet that about the link of autism and the MMR vaccine and has been retracted now. And this was an unpleasant surprise for me. It's like the genetic boards of North Carolina that promoted the sterilization of patients without their consent. And I had a patient that was sterilized, and basically that's how I learned about this. So imagine like trying to convince her to do like COVID-19 research was very challenging. And also, click, is for the Latin communities, there are like a lot of people who have irregular immigration status, and there are language barriers, and there is not a lot of like trustworthy, reliable information in Spanish regarding the COVID-19 vaccine. And on top of that, social media main efforts regarding mistrust and misinformation are targeted towards the English language. So the amount of like misinformation you can find in like other languages, it's much more if it's not in English. Next slide. So what did we do? So it's I focused on the virtual town halls as a strategy of communication to address vaccine hesitancy and building the trust among minorities. And there are like three pillars here. One is the community. It's the people who have access to their like concerns, like teachers, owners of the shops, their pastors. Second, it's the healthcare community, us, and three is the communicator that help us deliver the message to the masses. Next, please. So we developed 4 town halls like between July 2020 and May of 2021. Next, please. And we developed in a Q&A questions with a panel of experts that I was a representative of the infectious disease community and the COVID-19 research. Next, please. And we also conducted surveys because we wanted to like know how much the surveys were actually working and if the people had any feedback to us regarding what can we do differently. Next, please. And the town halls were the result of a multidisciplinary effort, including many medical and non-medical organizations. And these are the logos of the organization that help the development, coordination, or diffusion of the town halls. It's like, then you will see the logo of the Caballo Health Alliance. My classmate, Dr. Coyle, like helped me like to develop one of the town halls. Wake Forest, which was like one of the major players that help us with the support. There is like a national TV station. Next, please. The Foresight Health Department. Click, please. Local newspaper. Click. The National Institute of Health through the Community Engagement Alliance also help us in the development and give us some like feedback. Click, please. Local radio station and other organizations too. Click. So the results. One of the things with the surveys is like we asked them is how useful it was. I don't know if you can see it here, but they say extremely useful to the right and useful in the middle. And of course, like in every goal score, there are some people who were not very happy with our talks, but the vast majority of the feedback was really good, really positive, and people really like it. And next, please. And the amount of people that actually watched town hall exceed our expectation. If you can see the last town hall, we have like 10,000 people watching live in Spanish, and that's probably an underestimate because it's only counting the people that basically were watching at that moment. Basically, the videos were recorded, and there are multiple different platforms in YouTube, Instagram, social media. Every social media that you have it, there's a video version for us, and it has been reproduced multiple times. I can only count it people that I know that watch at that particular moment. Next, please. And also, it's the NIH included the talks in the brochure, educational brochure for healthcare providers. And click. And that is me saying in Spanish that the vaccine is not a live virus and cannot give you COVID. There were many misconceptions that we have to address during the town halls, like the use of fetal cells, which vaccines is better, should I get vaccinated, I have this disease, and like most of the concerns that basically like I usually address by different communicators in English, and I basically like try to take a little bit of all of them and try to do it in Spanish. Next slide. And also we have like newspapers covering the town halls in both locally and click please, and national news as well. Next. So the conclusion, from a leader perspective, the project allowed me to foster my skill in pretty much everything that was part of the leadership project. I have to speak in public with thousands of people. I have to like work with different color energies. There was like people with yellow and red and green, and you have to interact with all of them. I have to bring the changes from my organization. I have to coordinate with multiple people, and also it's like I have the. And now, for example, when I'm watching the news, it's like I'm not watching so much what they are saying. It's I'm watching how they are saying, how they communicate, the use of the body language, and also I have to learn a lot about healthcare and healthcare delivery. Next. And one of the things that made me really proud is that in July 2021, the CDC released a report highlighting the North Carolina equity about like COVID-19 vaccines, and we're among one of the best states regarding the indicators among minorities and COVID-19 vaccine. For you to have like an overall picture, it's right now it's 53% for whites, 49 for African American, and 50 for Hispanic. So the gap it's not that large compared with other states. Click. And the town halls where we tailor messages for the African American and Latin communities represent an effective communication strategy to help overcome some of the hesitancy that these communities may have. And I have done some other town halls after that, and we received many requests to do more, but due to time constraints, we try to limit it to just 3 or 4. Next, please. Those are my reference. Next. And that's me getting the COVID-19 vaccine, because we have to preach with example. And I would like to thank you to all the people that helped me with to its town halls, like to North Carolina Medical Society. And I have to give special thanks to my classmate, Dr. Clyde, from the Cabarrus Health Department, Dr. Matson, who inspired me to continue to do this these town halls, Dr. Matthews from the Maya Angelou Center for Health Equity, and what else? And that's it. Thank you so much for your attention, and I really appreciate all of you listening to me today.